A very good afternoon to everyone who has joined our Facebook Live session today. We have with us Dr. Kannan Prema, Consultant Plastic Surgeon, Reconstructive Surgery, Regenerative Surgery and Cosmetic Surgery, Apollo Hospitals, Greaves Road, who will be talking to us about cosmetic surgery today. Her expertise sees her being a part of renowned medical research and educational organizations such as Keloid Research Foundations, KRF USA, European Union Pressure Ulcer Advisory Panel, and the International Federation of Adipose Therapeutics and Sciences. She was a keynote speaker at the International Society of Regenerative Plastic Surgery, ISRPS, a forum with many renowned surgeons from all over the world. We are very happy to have you with us, Doctor. So to begin with the session, the basic question of the day: what is cosmetic surgery?
Cosmetic surgery is, a person is beautiful already or normal looking, who's happy with their looks, but want to enhance little about their looks. So we do that enhancement. So that is called cosmetic surgery. So it is there, we are enhancing is cosmetic.
What is the difference between cosmetic surgery and reconstructive surgery?
Yes, as I told you before, a normal human being has a part which is normal, they want to enhance, it is cosmetic surgery. The normal part which is there, which is affected, and we have to recreate the same part is called reconstructive surgery. Yeah.
Could you please enlighten us about the different types of cosmetic surgeries?
Well, cosmetic surgery can be done from head to toe, starting from the hair transplant to facelift, to eyelid corrections, to lip enhancement, to neck lift, to breast, to chest, to make the tummy flat, and genitalia reconstruction, then thigh lift, then creating a nice sexy cuff, and giving a good fat fill to the arms and foot. So head to toe, anything we can do in cosmetic. Yeah.
How is a patient's physical condition evaluated prior to a cosmetic surgery?
Like any other surgery, we'll evaluate the patient overall, their hemoglobin status, their medical problems. And when it comes to cosmetic, we also evaluate their psychological status.
Please do tell us if cosmetic surgery is safe, and how will any surgical complications involved be handled?
Definitely, it is safe with safe surgeon and safe setup with the safe procedure chosen. Yeah.
And in case of complications, how might they be approached?
Complication can be mild, moderate, severe, depending on what type of complication arises. We can handle them, but the complication rate is, as such, in cosmetic surgery is minimal. I will say about 0.1 to 0.9%, not even 1%.
This is considering facts in India.
All over the world, international standards. Yeah.
Is cosmetic surgery in general painful, and how would one have to prepare for their surgery?
Well, it's not painful. The pain is the same like any other surgery, and we give good analgesics, and pain perception is individual dependent. Some patients may be, some clients may be good threshold, some may have low threshold. So it all depends on the clients as such, and we can handle it. Yeah.
So does cosmetic surgery have different effects on men and women?
Well, it depends on the procedure, what they choose, and for what they want. Yes, the sex is different, so the results will be different.
So considering a similar treatment for both men and women,
okay,
liposuction, would the effect be different on a man and different on a woman?
Practically, no.
Psychologically, when one wants to approach a cosmetic surgery, how should they approach it from their psychological perspective?
First, you should be knowing what you want in cosmetic surgery and which part of the body you want cosmetic surgery and why do you want it, and how motivated are you to have that procedure. So once you are motivated and determined and clear about your results, then you approach us, you can discuss with us. Not every patient who walk into our office, we put our knife, we talk to them, we analyze what they want. We see whether their expectation really is acceptable. and whether it matches what is the acceptable result. And then we perform the surgery on them.
Doctor, like you had just mentioned, that one of the questions a patient needs to ask is why cosmetic surgery? How does one understand or approach or evaluate cosmetic surgery as an option itself before coming to a doctor?
Well, this is an era of internet, you know. See, you're seeing me live on Facebook. So when you think about cosmetic surgery, the first thing is you will Google, and then you will compare your body parts with the celebrities you know, or some role model you know, and you want to replicate like them. So then you will approach cosmetic surgeon and you ask, doctor, I want to be like this. I want to be like Deepika Padukone or Samantha face or whatever it is. And then we will tell you the realistic options depending on your framework. And then we can discuss and come to a conclusion whether it is possible or not.
Are there any particular products that one should limit themselves to when they have decided to go in for a cosmetic surgery?
Well, yes. If you're on some chemical peels or something, we will advise you not to do that when you're planning for a face surgery. Yeah.
Could you please tell us about the possible risks involved in cosmetic surgery?
Well, the risks are same, just like any other surgery, like neurosurgery, orthopedic surgery, cardiothoracic surgery, or any surgery, the risks are same. But since cosmetic surgery is 100% elective surgery, which means it's not an emergency, it's a planned surgery, we treat all the medical comorbid conditions like diabetes, hypertension, or any other problem firsthand, and then we plan for the surgery. So risks, as I said, is very, very, very minimal.
And is the approach the same in case we look at a reconstructive surgery as well?
Reconstructive surgery can be an elective surgery, that is a planned surgery, but 80% of the time it is an emergency surgery where we have to perform to bring back the function immediately, where we have to perform the surgery to bring back the life immediately. There we have to take risks. So the risk percentage and the complication percentage goes up to 10 to 15%, but still we can handle.
Yeah. Thank you, doctor.
Yeah.
Now, what are the risks involved with the anesthetics in case of a cosmetic surgery?
Well, see, as I told you before, this is a planned procedure and we evaluate all the medical problems and the psychological aspects. So the given client who comes for the cosmetic surgery, they discuss with the cosmetic surgeon as well as the anesthetist, and we can analyze the pros and cons, and yes, it can be made safe with minimal risk, as I told you before, 0.1 to 0.9%.
Okay.
Yeah.
Thank you, doctor.
Yeah.
Now, when we look at the kind of anesthesia involved in cosmetic surgery,
Yeah.
what is the kind of anesthesia that would be provided, and who would be providing the anesthesia?
Well, it starts from local anesthesia to regional anesthesia to general anesthesia. Local anesthesia is just numbing one part of the body where we are going to operate. For example, the eyelid surgeries, what we do, we can do under local anesthesia, where we can see, the patients will keep talking to us. And regional anesthesia is, for example, we are doing arm tug. We can anesthetize that limb only. And still the patients can keep talking to us. Well, when we are going to do liposuction and facelift, neck lift, and other parts of the body, of course, yes, we give general anesthesia that will keep patients calm and the surgeon calm.
Now, which procedures amongst cosmetic surgeries would be the riskiest?
Well, see, I cannot give an exact answer because the risk percentage will be maximum 0.9%. That could be for any procedure for that matter. Yeah.
In general, what is the recovery from cosmetic surgery like?
Well, depending on the procedure, but the average recovery time will be 3 to 6 weeks.
And what is the post-operative information that one would need to know in terms of work, exercise, and personal care?
Well, that also depends on what procedure we are doing. For example, if we are doing liposuction, we will give pressure garments. We will advise not lifting weights for some time. And we advise massage for a 3 to 6 weeks period and all that. So it depends on the procedure, what the patients undergo. And usual recovery time, I will always say, Overall, this is overall 3 to 6 weeks or sometimes 8 weeks. For you to have a perfect result, I will say you have to wait for 8 weeks.
And the results would differ from patient to patient.
Yes, of course. Everybody is unique.
How long might the results last in case of different cosmetic surgeries?
Well, this also depends on what procedure you go. Cosmetic surgery is not permanent. It will last for a longer time, but not too long. For example, if we are doing a facelift, that will last for about 10 years. And slowly, as the aging progresses, you will see some fine definitions of aging on your face. That also is applicable to other parts of the body when you do the cosmetic surgery. Yeah.
What sort of scarring could be expected after the cosmetic procedure?
Well, usually in cosmetic surgery, we keep the scars hidden. But sometimes when some patients are prone for keloid, which means when there is a scar, the scar exceeds the scar line. So such patients, when they have history, we will warn them of ugly scars. So they have to decide between the surgery and the scars. And still we have treatment for the scars, which is an extended procedure.
Now, when we look at cosmetic surgery when it comes to the face mainly, how effective are facial peels when compared to cosmetic surgery?
Facial peels have a different role and surgery has a different role. Facial peels give the glow and tightness to certain extent. Surgery gives a good defined look according to the bony architecture.
What are the types of procedures performed to improve the texture of facial skin or improve scars or tighten and lift sagging skin around the face and neck?
Well, starting from the chemical peels, lasers, and facelift surgery, we also give PRP injections, which is the platelet-rich plasma taken from patient's own body. And we also do liposuction and take nano fat. And we convert that fat for injection and give it in the depressed areas of the face and enhance the look. Yeah.
So in case of tighten and lift sagging skin around the face and neck?
Well, we combine with facelift along with the fat injections. That gives a youth look. See, just pulling the face tight is like pulling a sheet over a small box. When we fill it up with fat adequately, it gives a youth look. Youth look is fat face. Yeah.
What results can one expect? And what is the time frame of result regarding a facial rejuvenation procedure?
As I told you, maximum will be 8 weeks.
So is liposuction a weight loss procedure, and about how much fat could be removed?
Well, liposuction is never a weight loss procedure. It is only body contouring. By massive liposuction itself, we can take only 3 to 4 liters of fat, which is not going to help you in weight reduction at all. We can contour, that is, define that part of the body with liposuction. Never ever think that liposuction is an alternate to weight reduction. No.
What would be the age limit for a liposuction?
In practically, we can go up to age of 70. And after that, already the skin is sagging and it is loose. So we don't recommend. But still, if the client insists, we will assess the risk factors. We'll explain the pros and cons, and still we can do. So, oldest patient was 78 years, lady. Yeah, she had a tummy tug with the liposuction.
So, if you could just run us through what happens during the procedure and how it is performed.
Which procedure?
A liposuction.
Well, under general anesthesia, we inject tumescent into the specified part of the body, and we wait for some time for the hemostasis to happen. And then we insert a small cannula, which is the pencil size, and make a small punch into that. Liquefy the fat and take off all the fat and see how much fat we are taking. We'll wait. The maximum point is the blood should just touch the cannula. After that, we stop the procedure and then we give adequate pressure. And maybe after 4 or 5 days, when we open the dressing, there will be edema, that is the swelling around. Because of any surgical procedure, the edema will happen. So immediately we give the pressure garment, and that edema will take about 3 to 6 weeks to settle. And then you can see definitely very good result.
Does the liposuction procedure differ for different parts of the body?
Yes, it differs.
That difference would be in terms of time taken of the procedure and in terms of the
time taken for the procedure, the amount of fat we take out, and what is the extra procedure we have to do. For example, when we are doing arm tug, if we do liposuction only, it's going to have a bagged result. It's like a balloon filled with water. When you take off the water, the balloon sags. Likewise, when you take off the fat from the arm, we have to do arm tug. We have to excise the extra skin and give a beautiful stitch in the hidden area.
So how does one ease back into their regular routine after a liposuction surgery?
Of course, yes. Routine like your daily routines you can do very next day. Office routines you can start after 10 days. And lifting weights, gym, everything you can hit only after 3 weeks.
So once liposuction has been performed, like you mentioned, it's not an alternative for fat reduction.
Yeah.
Is there a possibility of the patient gaining fat in those regions again?
Of course, yes, 100%. If you don't maintain your diet, if you don't follow exercise, you will put on fat back in the area where it was liposucked. See, liposuction is helping you to contour early, but maintaining is in your hands. You have to do your exercise properly. You have to maintain your diet properly. Otherwise, you will get back 100% fat in that area. Yeah.
And is there a chance for the fat to reappear elsewhere after the liposuction?
The same fat, see, that fat we are taking out. So the fat, whatever is depositing, is going to be the same anywhere. If you don't maintain your diet, if you don't do a proper exercise, of course, you'll put on weight and fat will deposit in any part of the body. Yeah.
So we have generally heard about Botox.
Yeah.
So please do tell us something about Botox.
Botox is a temporary procedure to ease out wrinkles on the face, which is cosmetic related. Of course, it has other purpose also, non-cosmetic purpose. But cosmetic purpose, I'm saying, is to ease out the wrinkles. And this is a temporary procedure. This will withhold for 3 to 6 months maximum.
And what might be the long-term effects of a Botox treatment?
See, any medicine for that matter, when it is used long-term, it has its own side effects. So we will not recommend Botox for a long time. If at all you're using for a long time, I will suggest you to go for a cosmetic surgery, which has extended longevity.
So would that be an alternative for Botox?
Not for all patients, but some, yes.
So what are the other alternatives that we could look at in case of Botox?
You can do lasers to do skin tightening. And depending on the skin type, we can also do fat injections into the skin to make it... fat injection is coming in a big way. It's coming in the regenerative medicine. So fat has stem cell potential. So taking a fat and making it nano fat and giving injection has a fantastic result. And apart from that, yes, surgery. Yeah. So we can put it like this: Botox, lasers, then fat injections and surgery. Yeah.
Now, what is the difference between open and closed rhinoplasty?
Well, when we open little, it is closed. When we open more, it is open. Yeah.
So does one
technically
does one have to follow a special diet pre-operatively and or post-operatively during a cosmetic surgery?
Of course, yes. For liposuction, if you're coming for a body contouring surgery, yes, we will advise you to follow a low-fat, healthy diet if you want the result to be maintained for a long time. And of course, when you come also for the facelift surgery, you basically do facelift because you want to look young. So looking young is not only surgery, it is starts from your home, which means it starts from your diet. Yeah.
Is diet an important aspect even in case of rhinoplasty?
Not exactly, but we will ask you to avoid food which is cold,
Is there a possibility of a person's voice to change after rhinoplasty?
No, no.
So we have someone who's asked us
Mm.
that they wear eyeglasses.
Mm.
So how soon can I wear them normally after the procedure?
See, when we give a splint, you can try wearing on the splint, but if the splint is causing some hindrance, don't use it. Maybe after 7 days when we take off the splint, yes, you can use your glasses.
So when we look at facelift,
Mm-hmm.
what type of facelift can be done to raise cheekbones?
Cheekbones means, you mean this one or this one? Because some take chin and cheek different. To raise this, of course, with the facelift, we have to add some implants to this jaw bones. So that gives an augmented look. And along with that, we can also give some fat filling into this chin area. So that also gives an augmented look.
What are the risks and complications associated with a facelift?
Well, as I said before, it depends on the surgical procedure and the surgeon. The risks are injury to the facial nerve is there, but when we are safe, we can avoid it. And depending on the patient's overall condition, the healing may be late. Maybe generally if it is 9 to 10 days, for some patients it may be 15 to 18 days or something, but not much. Yeah, but we have to be very careful with the facial nerve.
So how are complications handled in case of a facelift? And what are the post-operative procedures that they would have to follow?
See, complications part, we will take care and we will see to that it doesn't happen. And the chances are very less. Post-op care, yes, we will tell you, we'll give you plasters, we will ask you to take proper diet, plenty of water, adequate rest, and avoid injury. That's it.
So does, after doing plastic surgery, cosmetic surgery,
yeah,
how risky is it for one to be exposed to the sunlight?
Well, if we are adding peels, chemical peels along with the cosmetic procedure, we will advise you not to get into the direct sunlight. But otherwise, it doesn't matter much. Yeah.
So after a facelift, how can one expect their face to look over time?
We cannot drastically change your face, but we can make it much younger than what you are right now.
So what are the options for someone if they are dissatisfied with the cosmetic outcome of the facelift procedure?
Well, it is individual dependent. That is why we discuss all the procedures and the outcomes before surgery. We will give you realistic results. And once you're satisfied, we will ask you to go for the procedure.
Okay. So we have someone who's asked us, I am a psoriasis patient. Can cosmetic surgery help me in any way in hiding my skin?
No. See, when you have psoriasis, in fact, your wound healing will be delayed. And the psoriasis may aggravate because of the surgical trauma. So we will advise you to take treatment for the psoriasis and then come for the cosmetic procedure, because there is no cosmetic procedure to hide the psoriasis right now.
So doctor, how are the cosmetic surgery facilities and quality of treatment in India compared to other countries? Kindly enlighten us on this.
Well, India is a very big market for cosmetic surgery, and we have a lot of patients coming from other parts of the country here because our results are international standards comparable, and we are lower cost than them. Yeah. And appointments are easy.
So when we compare to other countries, cosmetic surgery is also a little.
We are in par with the international standard, but we are cheaper than them. Means we are cost effective than them, and appointments are available easy. For one cosmetic procedure, the patient has to wait in other parts of the world for weeks together. But here you walk in, you decide, you get operated, you leave.
That's wonderful.
That's more convenient. Yeah.
So, doctor, what are the facilities and treatments available at Apollo hospitals for cosmetic surgery?
See, we have all the international standards here, everything. You can walk in. You have to come to experience. Yeah.
So, how does one have to approach a cosmetic surgery requirement at Apollo hospitals?
Well, you have to fix appointment with the Apollo hospitals and meet us.
Any challenging cases you wish to share with us, doctor?
Well, right now the challenging thing is mummy makeover. That's a very big thing. So young girls after pregnancy, they want to look back to normal. That's definitely challenging and tedious for us. And yes, of course, we do it. Yeah, but we cannot reveal the names. It's highly confidential.
Any particular procedure that you would like to take us from the pre-op to the post-op to just tell our viewers about an experience of how surgery was undertaken?
Well, mummy makeover, see, I would like to talk more about mummy makeover because that's a common procedure happening all over the world. And it's not only the young girls after their pregnancy, they come here, even the older mothers, when they came to know that such thing is happening, they bring their younger photographs. They say, doctor, make me like this. So when we look at the photograph and the patient, we'll be taken back, and it's a very, very, very tough for us. We have to rejuvenate the face, we have to reduce the face, and we have to take off all the aging signs. We have to make the neck nice, beautiful, carved, and the breast proper shape, the tummy proper shape, the waist proper angle, and the thighs the proper shape, the gap between both medial angle. And most important thing is the women are more concerned about their genitalia, how it looks. Post-pregnancy, the genitalia also changes, and they are very particular about it in that mummy makeover. So it is challenging. So it is between me and my client. They know how it looks. Yeah.
Doctor, in India, what is the most common cosmetic surgery that patients approach doctors for?
Liposuction for men and women, gynecomastia for men, hair transplant for men, and women breast.
And finally, doctor, what would be the most important bit of information you would like to give to our viewers watching this FP Live session?
See, I will tell all the clients and patients everywhere, be realistic in your options. Just because surgeries are available, don't go for all the surgeries. See what is required for you. Have a realistic option. Decide on that and then come to us. We are here to help you.
Thank you so much, doctor.
Thank you.
It has been an extremely informative session, Dr. Kannan Prema. Thank you very much for your time. For appointments and consultation, please get in touch with Dr. Kannan Prema, consultant, plastic surgeon, reconstructive surgery, regenerative surgery, and cosmetic surgery, Apollo Hospitals, Greaves Road, at 9340012345. I repeat, 9340012345. Thank you and have a nice day.